Before contracting COVID-19 in March, Beth Moore was skiing, staying active with her family, and working hard as an attorney. Her symptoms lasted through April and went away, but in May, her mind and body went haywire.
I was truly convinced I was having some sort of like mini stroke or a heart attack.
And it didn't go away.
I found that even with, simple things like having conversations with my kids, I'm forgetting words. Like I'm saying, I'm talking about the refrigerator, but I'm saying, go get a drink out of and I can't find the word for refrigerator in my head, which is like bizarre. That has never happened to me before.
Tasha Crabtree first got sick in March. She has also been fighting what she calls COVID brain.
I can sit here and have a coherent conversation with you, and then halfway through a sentence, I will forget a word. And I will focus so hard on that word that I completely forget my train of thought.
The women are among an estimated 1/3 of COVID-19 patients who experience neurological symptoms. It can show up in ways like struggling to think and having a lapse in memory.
I'm sorry, I find it very difficult to describe what it actually feels like, but it's like, let's see. Well, here's an example. I have lost my train of thought.
Now clinics are popping up specifically for patients like these two. Dr. Igor Koralnik is the chief of neuroinfectious diseases and global neurology at Northwestern Medicine. His neuro COVID-19 clinic in Chicago is swamped with patients from all 50 states.
We are in high demand. There are, many more patients that we can see, even if we were going to go at it 24/7.
Some symptoms are mild, like those experienced by Beth Moore and Tasha Crabtree. Koralnik says he's also seen COVID-19 patients develop stroke, seizures or paralysis, and mental health disorders. A new Oxford study found COVID-19 patients with no prior psychiatric history had an increased rate of psychiatric diagnosis the 3 months after infection.
Why this virus caused all those problems is not entirely known at this point.
Koralnik uses MRIs to measure the impact COVID has on the brain. Some patients take an NIH-developed cognition test that lasts about 30 minutes. They'll come back a few months from now to examine if the tests show any decline that could give clues about long-term effects. There's individual stories from patients about little wins. For Tasha Crabtree, it included going back to work in her Nevada vet office.
I was able to do some of the more difficult aspects of my job without mistakes, without error, and so it does feel good.
But the big question remains, what will long-term brain impacts be?
I hope that the patient with a minor brain fog will go back to full recovery over time, but it's too early to tell.
I'm hopeful though that we'll eventually get back to our normal baseline. Like that's my hope, that's my goal, that's what I want. But the fear that's in the back of my head is that this is my, new reality.
For Newsy, I'm Lindsay Thies.